Good morning. I'd like to call this meeting to order of meeting of the Minnesota Senate Health and Human Services Finance and Policy Committee. It is Tuesday, March 17th, 2026. And our first bill on the agenda today is Senate File 3902, Senator Seeberger. Welcome to the committee, and please go ahead and present your bill.
Thank you, Madam Chair and members of the committee. I am pleased to be here for Senate File 3902. This is a bill that's about transparency and providing data for meaningful oversight in our local ambulance services. This bill will give policymakers the ability to examine both service delivery and the costs associated with those services. Most of the data required in this bill is already collected and reported to the Office of EMS by ambulance providers. This bill emphasizes that the data be made publicly available, ensuring that municipalities, policymakers, and residents have visibility into both service delivery and associated costs. Residents and local officials should be able to understand the level of service being provided in their communities, as well as any changes that may occur over time. Transparency around fees is particularly important, where residents have no practical choice of provider, and yet the local ambulance service is able to abate fees if they are not paid. Thank you for considering this legislation, and I have with me Identifier Chief Andrew Slama to talk more about these issues.
Thank you. Mr. Slama, if you could state your name for the record and begin your testimony.
Thank you, Madam Chair. My name is Andrew Slama. I'm the Identifier Chief and here on behalf of the Minnesota State Fire Chiefs Association. I want to thank Senator Seeberger for introducing the bill. The bill is designed to provide EMS data to municipalities to better understand a dynamic and complex service. Using data points already collected by the Office of EMS, the Director will provide such report and ensure the burden does not fall onto each service. The letters submitted all confirm there is no opposition to the report. Rather report the confirmation that Office of EMS should provide this report to municipalities. One item not currently reported is the fee schedule. The fees for transport, this added metric will ensure the public will know the amount that is required of a transport that's not currently required to be reported. Making it publicly reported provides transparency in a fee where you do not get a choice in the provider. I want to thank everyone for looking at this bill and ensuring that we have accountability and transparency in our EMS service. That's critical for the sustainability of the service in the long term. Thank you for your time, and I'll stand for any questions.
Thank you. And I have two other testifiers, Ann Finn, and if Dane Meyer could come forward. Welcome to the committee, and please state your name for the record and begin.
Thank you, Chair Wiklund and members of the committee. My name is Ann Finn, and I represent the League of Minnesota Cities. The League is a statewide association representing 842 of Minnesota's 856 cities. I want to thank Senator Seeberger for authoring Senate File 3902, and thank you for hearing the bill. The League appreciates the challenges faced by ambulance services throughout the state and is grateful for the legislative support for ambulance providers throughout recent years. The funding and policy bills enacted have provided essential resources during a critical time for the state's emergency medical services. The League supports requiring licensed ambulance providers to collect pre-hospital care data for all emergency responses within each municipality within each primary service area. This data collection will help improve transparency within Minnesota's ambulance industry and will ensure primary service area license holders will be accountable to all of the communities they serve. The data collected will also help the Office of EMS identify where gaps exist and where more resources may be needed. I urge the committee's support for this legislation. Thank you.
Thank you. And if you could please state your name for the record and begin your testimony.
Dane Meyer with the Minnesota Ambulance Association. Chair Wiklund and members of the committee, on behalf of the Minnesota Ambulance Association, which represents ambulance services across Minnesota, we write regarding Senate File 3902, which would establish a new ambulance data reporting requirements under Minnesota Statutes 144E 1.123. While we support the reasonable use of data to improve emergency services, Senate File 3902 raises serious concerns related to patient privacy under the Minnesota Government Data Privacy Practice Act. The bill would require ambulance services to report detailed information about every emergency response within each municipality and directs the Office of EMS to make the information publicly available each year. In many Minnesota communities, particularly smaller towns, there may be only one cardiac arrest, overdose, suicide attempt, or serious trauma call in a year. Publishing detailed response information such as dispatch reason, response details, and transportation destination could make it possible for an individual involved in a deeply personal medical emergency to be identified. For example, in a small town, residents are aware that an ambulance responded to a particular home or incident. Publicly released data describing the type of call and hospital destination could effectively confirm the nature of the emergency, of the medical emergency. Even if names are not included, the combination of details could reveal sensitive information about a neighbor, co-worker, or a family member's health crisis. This type of inadvertent identification risk is precisely why the classification and release of high health-related data must be handled carefully under Minnesota's data privacy laws. We believe the proposal raises significant privacy issues that merit careful review, including by Senate Judiciary Committee. It is also important to note that Minnesota Ambulance Services already submit extensive pre-hospital care data through existing reporting systems. Licensed services submit electronic patient care reports through the MinStar Elite system, typically within 24 hours of a call. These reports follow the national EMS data set and include detailed information on dispatch, reason, patient assessment, vital signs, interventions, and transport outcomes. The Office of Emergency Medical Services already collects and analyzes this data for oversight and system improvement. Given the breadth of existing reporting, Senate File 3902 may duplicate information that is already available to regulators while creating new risk related to public release of sensitive emergency response data. Minnesota Ambulance Services are committed to transparency and continuous improvement in patient care. We welcome the opportunity to work with legislators and the Office of Emergency Medical Services to ensure any future data reporting proposals protect patient privacy and align with existing reporting systems. Thank you for your consideration.
Thank you. Members, questions or comments about the bill? Senator Mann.
Thank you, Madam Chair. And I'm not sure, I just got a couple questions and anyone can answer them. For on line 2.2, the type of emergency service requested, is that going to say it was a medical emergency or is that going to say it was a drug overdose due to heroin?
Senator Seeberger?
Thank you, Madam Chair and Senator Mann. It will provide the dispatch reason, which to address the Minnesota Ambulance Association concerns is already publicly available. Anyone with a scanner can hear that reason. A dispatch will come across, for example, using my own agency, Lower St. Croix Valley, Ambulance 1, please report to 123 First Street for a 41-year-old female in seizure. If you have a scanner, you're going to hear that. And that is the type of information that will be provided in this report. If you have a scanner, you're going to hear ambulance 1 en route, ambulance 1 on scene, ambulance 1 transporting, ambulance 1 no transport, DOA. You'll hear all of this if you have a scanner. So it's not as private as people might think, but this is just data that's going to be reported so that there is transparency. I hope that answers your question.
Senator Mann.
Madam Chair, and then on line 2.6, the patient pay fee schedule, what does that mean?
Senator Seeberger.
Thank you, Madam Chair. Perhaps Chief Slama could help me out on this one. Different agencies provide or bill at different rates. So we have a fee for service system. Lower St. Croix Valley Ambulance may bill one rate for an overdose or cardiac arrest, whereas my other employer, Alina, may charge something different. In the case of Lower St. Croix Valley, we are a city-based service, so the cities are aware of what our pay structure is. In the case of Alina, that's a private hospital system providing services to many different cities across the metro area. They do not provide their pay structure. So the cities are at the mercy of that system. What we're looking for here is transparency, so that a city such as Lino Lakes, which is served by Alina, can look at Alina's pay structure and then look at, let's say, I don't know, somewhere where they're not covered by a hospital system and see if they align. And are they being charged too much? That's what we're looking for, is that kind of transparency. How'd I do?
You did very well.
Okay.
Senator Mann.
Thank you, Senator. Thank you, Madam Chair, and just wanted to personally welcome the finest fire chief in all of the state.
Thank you, Senator Mann. Any other questions? Senator Abler.
Well, thanks, and I appreciate the report, too. I've got, there was an issue on Channel 9 reported about the fellow who, an elderly guy, slid out of his chair and tipped him into the corner, and he died because the staff there had a rule you can't pick anybody up, and so I think that's, you know, horrible. And so the point of the legislation in a different committee is to, hey, you can pick up people who slide out of their chair, but instead they call you all. Could you just comment about how many calls you get like that are really non-emergent and waste your time?
Senator Seeberger.
Thank you, Madam Chair and Senator Abler. Yes, we call those lift assists. And we are happy to come out and assist anyone with a lift assist. We did a few over the weekend. When we come out and perform a lift assist, we also do a full evaluation. Why did you fall? Did you get injured when you fell? Is there something else going on here that may need medical attention? A lot of times when we show up, just help me up, it's okay. But we do help you up. Oh, look, it's because your blood pressure is 40/15. Maybe you should go in. So that's a service we're happy to provide. If it is a true lift assist, somebody that's just too weak to get back in their chair, no injury, there's no charge. So we don't charge for those services. The greater picture, you know, how many times are we called for things that are not emergencies? People forget the E in EMS is for emergency medical services. There are some days I joke to my partner that instead of paramedic here, let's just put a piece of tape and write Uber, because people do use the EMS system for non-emergency calls. I think the chief can probably support that as well. That's a greater problem that we have to talk about at another time, but it certainly does make up a pretty high percentage of our calls depending on the day.
Thanks,
Senator
Madam Chair.
Abler.
And just to be brief about it, well, I'm glad that we're going to at least measure it. Some companies have a policy just because liability, like, I mean, people go to assisted living thinking that they're going to get assistance. So, and plus, maybe in the metro, there's plenty of you to go around out in greater Minnesota. It's just an issue. So anyway, just thanks for that. Just wanted to call attention to that. Thank you.
Any other member questions or comments? Seeing none, Senator Seeberger, this bill, we will lay it over. It seems like this opportunity to get more transparency would be helpful as we look at healthcare costs across our system, and having these reports would help us in a way to understand better, you know, how much is being spent across the state and variations. So I hope you'll continue to have discussions with people, and we will lay the bill over for now and continue discussing. So Senate File 3902 is laid over.
Thank you.
Thank you. Next on our agenda, we have Senate File 2868, Senator Clark. Good morning. Welcome to the committee, Senator Clark. It looks like you have a delete everything authors amendment, the A1. Would you like to adopt that first and then present your bill?
Yes, Madam Chair and members. The DE amendment removes the optional random drug testing requirement for all individuals who receive SNAP and includes language based on technical assistance we got from DCYF.
Madam Chair.
Senator Abler.
I'll move the bill and the amendment.
Senator Abler moves the A1 amendment. Members, all those in favor, please signify by saying aye. Aye. Any opposed? The A1 amendment is adopted. Senator Clark.
Thank you, Madam Chair and members. Thank you for the opportunity to bring you Senate File 2868. This is a bill that removes optional drug testing requirement for individuals on SNAP who have a prior drug felony conviction within the last 10 years. First, I want to be clear about what this bill does not do. It doesn't change who is eligible for SNAP or how the program operates. It doesn't expand benefits or change the number of people who qualify. What it does do is remove the random drug testing requirement for SNAP participants with a prior drug felony conviction within the last 10 years. Bit of background. In 1996, Congress created a lifetime ban on SNAP eligibility for people with a prior drug felony conviction. However, states can and do opt out or modify that federal ban. Today, 28 states, including Michigan, Ohio, Colorado, Louisiana, and Maine, have fully removed the ban. We, Minnesota, have modified the ban under current law. Anyone with a drug felony conviction within the last 10 years who receives SNAP can be required to take random drug tests at the discretion of county administrators. There is no other type of felony that carries this condition. In practice, this creates uneven treatment across our 87 counties, what some call justice by geography. Whether someone faces a random drug test should not depend simply on where they live. This also creates unnecessary barriers. Individuals may struggle to meet testing requirements because of barriers outside their control, including the lack of transportation, childcare duties, costs, or conflict with their work schedule. Drug testing should be a tool for recovery when part of a treatment plan, not a county-by-county condition for food access. Plus, removing this provision helps people re-entering their communities and their families to succeed. Research shows that states that have fully ended the SNAP drug felony ban have a lower rate of substance use disorder than those that don't. So when it's been removed, lower substance use disorder, showing that fewer barriers actually to support SNAP lead to better outcomes. Clear and consistent eligibility rules for SNAP benefits also reduce error rates. Lastly, this bill follows recommendations from the legislatively established Task Force on Holistic and Effective Responses to Illicit Drug Use, which included representation from medical experts, law enforcement, and the justice system. So this bill removes barriers to participating in the state's SNAP program for people with a prior drug conviction. It ensures that food assistance is not conditioned on an optional random drug testing requirement that serves no public benefit. By removing this barrier, we improve food security, health, and stability for families. There's a handout in your packet, and you'll see that it has a broad range of organizations' support of this, from agriculture to food security organizations and nonpartisan criminal justice reform organizations. And with that, I turn it over to my testifiers.
Thank you. Welcome to the committee. Ms. Webster, if you could state your name for the record and begin.
Thank you, Madam Chair. My name is Jessica Webster. I'm a staff attorney with Legal Aid, and we're supporting Senate File 2868, and would really like to thank Senator Clark for bringing it, for that beautiful statement that is probably, I don't need to replicate a lot of those remarks. I've been with Legal Aid for 20 years, and excuse me, in that time, I've watched our state on a bipartisan basis develop a more nuanced and compassionate approach to substance use disorder and to addressing hunger. And the approach that our state now takes acknowledges that when people are fighting to get better, to stabilize their jobs, their housing, their families, we're ensuring that people have access to food as a core component of their healing, their second chance, and their recovery. This, as this committee is aware, substance use disorder affects every corner of the state, and at Legal Aid, it intersects with all of the issues that we help people address: housing and homelessness, employment, healthcare access, family law. And beyond these policy considerations that the senator mentioned and that I've mentioned, the federal government has asked our counties to reduce our SNAP error rate, not the fraud rate, the error rate, so the overpayment, underpayment rate. So anywhere and everywhere that we can simplify the SNAP program and support our counties in their processing is incredibly critical right now from a funding and appropriation standpoint. We appreciate your consideration.
Thank you. And Mr. Bratton, if you could please state your name for the record and begin your testimony.
Thank you, Madam Chair and members. Darren Broughton, Executive Director of Minnesota Agri-Growth, a broad statewide coalition of farm commodity groups, food companies, agribusiness, and logistic companies, including healthcare systems, supporting Minnesota's ag and food economy. I think this is the first time Agri-Growth has ever had to testify at Health and Human Services, so this is a whole new experience for us. But I'm happy to be here to do it to support Senate File 2868. Minnesota is home to more than 65,000 farms, and there's another 330,000 jobs that support Minnesota's ag and food economy. Those 330,000 Minnesotans work extremely hard every day to ensure that every Minnesotan has access to healthy and affordable food, and that we should not create unnecessary barriers to food access. Data shows that 1 in 5 formerly incarcerated people experience food insecurity. The random drug testing that is currently there creates additional obstacles to barriers or additional obstacles for individuals seeking to rebuild their lives. And that's why Senate File 2868 aims to remove those barriers, ensuring that access to food is not used as a deterrent. Consistent access to healthy foods has shown to improve productivity at work and academic success. Early evidence also shows that such access increases the purchase of healthy foods. For example, states that have implemented universal free school lunch and breakfast have experienced a 20 to 30% increase in sales of milk and cheese and other dairy products compared to states who have not implemented universal school meals. That's why Senate File 2868 makes so much sense. It creates healthier individuals, healthier families, and a healthier Minnesota food and ag economy. And I encourage the committee to support the bill.
Thank you very much. And I have one more testifier, Monses Franco. Welcome to the committee, and if you could state your name for the record and begin your testimony.
Good morning, Madam Chair Wiklund and esteemed committee members. My name is Monses Franco. That's M-O-N-C-I-E-S. I work for Hennepin Healthcare Research Institute with the Health, Homelessness, and Criminal Justice Lab. I am also a person whose history includes prior criminal convictions. I come to you in support of House File 1900 and Senate File 2868. I am here to say that everyone has value, and there is no compromise to that statement. That includes everyone in this room, but it also includes people who use drugs and people with histories of involvement in the criminal legal system. I walked out of prison in 2018. I didn't come home because transitional housing was a stepping stone, but not a place that feels warm and cozy like I would think when I hear of the word home. On the road to becoming the person I am today, while navigating the complexities of unmet needs and competing priorities, I am most thankful that I was eligible for SNAP benefits because, in a short truth, it kept me from committing crimes of poverty, like stealing food, which was a reality for me at one point in time. I have relatives that were not so fortunate and were disqualified from receiving SNAP benefits based on a felony drug conviction. This particular relative is female, a mother, and claimed responsibility for drugs that were not hers because the father of her children already had 2 prior drug convictions. I do not excuse the behavior or judge the psychology behind that decision. Rather, I focus on family separation that occurred and how a grandmother stepped up to become the primary caregiver, and noticing that the family system was never the same from that moment on. This is not a unique occurrence. It happened in my family and continues to happen in other families to this day. A 10-year random drug testing provision does nothing to address the complexities of a person who uses drugs. The comorbidities around substance use and mental health are statistically high. There are greater things to worry about rather than deciding who gets to eat. I know that personally because this year, on February 11th, my brother Jack Garcia died from an overdose. Jack had an incarceration history. Jack also had substance use disorder, and Jack was diagnosed schizophrenic. Everyone has value, including Jack, including, as I stated, everyone in this room, including my relative who was disqualified from receiving SNAP benefits due to the archaic policy that determines who gets to eat. Thank you kindly for hearing me out today.
Thank you for your testimony, and I'm very sorry for your loss. Members, do you have any questions or comments about the bill? Senator Atke.
Thank you, Madam Chair. And I just have, I guess, some concerns with this. I don't like the fact that we're removing the random drug testing. I think these are people that we fully sympathize with the struggles that they're going through, and you know, the human stories we just heard, they're very real. But to remove that, I think, takes away one of the tools that maybe helps keep them on track. And so that part I have a problem with. And then we had heard earlier that there is no fiscal impact with this bill, but I don't see how there cannot be, because the fact is currently some are being removed. And if we take away that barrier, you know, maybe it isn't a substantial amount, but there's got to be some fiscal impact, I would think anyhow, but thank you.
Senator Clark, did you?
Chair Wiklund and Senator Atke, thank you. Just to note, in the other body, this is supported by Representative Danny Nadeau, and it's moving through there. Just as an aside, to your point, in terms of removing a tool, this is a tool that is prescribed for folks that, where states have seen and removed this, they've actually seen drug abuse go down. So removing it from this provision, I can see how you get to that point, but the data has not proven that out. So I appreciate the perspective on that. In terms of the fiscal note, do you have a bit more on that?
Ms. Webster.
Madam Chair and Senator Atke, just to clarify, so SNAP is a federal benefit. So folks who are losing SNAP are losing a federally funded benefit. It's not a state-funded benefit for these folks. The second piece is most counties are not drug testing right now, not random drug testing, because you know, it's a burdensome process, and they're not funded to do this work. So it's difficult and it's challenging. And I don't think that, so for folks in recovery and folks in, you know, dealing with substance use disorder, they face drug testing across other programs as part of their recovery, as part of their treatment. Asking a frontline county worker to make a determination about whether someone should be drug tested and have their food taken away due to that result is kind of what the core component here is. So this has always felt quite a bit outside of a recovery and substance abuse treatment plan and pathway. It doesn't really fit with the recovery model that has developed across the nation.
Senator Atke, any other?
Thank you, Madam Chair. No, that's all. Thank you.
Senator Abler.
Oh, thanks. So I'm a co-author. I don't know about this testing thing. I'm not an expert on that, and that might be worth more discussions. But just in the grand scheme of things, you know, I think the state has moved into an area where we're trying to do more, you know, helping up and so on. So I like the idea about that, and anyway, I hope it can move forward, and the discussion should go forward. I think the questions that Senator Key raised, I can't answer, and people besides me know, but good luck with the bill. Thanks.
Thank you. Any other questions or comments? Senator Mann.
Thank you, Madam Chair, and thank you, Senator Clark, for bringing this bill. It's great when we have bills that are presented based on data, and I really appreciate that. And I think the data has shown repeatedly that drug testing is oftentimes not a tool that keeps people on track. And I do also think that it's past time that we start treating substance use disorder as a chronic illness and not criminal behavior. So thank you for bringing this bill forward.
Thank you. Senator Port.
Thank you, Madam Chair. Senator Clark, thank you for bringing this bill. We did a lot of work when we legalized cannabis to remove the punitive penalties that were built around prohibition. And this is one of those that has stayed and isn't just about cannabis. But we know that a lot of the punitive nature that was built into our criminal law system, particularly around drug crimes, has a very racist history and was built to target specific communities. We know better now about how to treat substance abuse disorder, like Senator Mann said, like a disease. Stripping those folks from food doesn't help anyone get better. And also, if we're removing the potential loss of benefits, then there is no point to drug test anymore. That's what the drug test was used for. So there's no point to continue that. So I appreciate you bringing this. I appreciate the humanity in this bill. Thank you.
Yeah, any other questions or comments? Senator Boldon.
Thank you, Madam Chair. I just want to say thank you, Senator Clark, for your work on this, and also thank you to the testifiers. Thanks for sharing your story. I'm very sorry for the loss of your brother. We should be listening to those with lived experience, and I appreciate the comments. There is evidence behind this. It feels like the right thing. We should be eliminating barriers for people to have access to the things that they need, including the most very basic of needs, food. And so this is the right thing to do. Thank you for your work on this bill.
Members, I don't see any other questions or comments. Senator Clark, thank you for bringing this bill forward. I appreciate the fullness of the testimony and the evidence behind why this bill is needed, and I appreciate your efforts on that and appreciate hearing from your testifiers. This bill we can pass and it can be sent to the floor. Any other questions? Seeing none, Senator Abler moves that Senate File 2868 as amended be recommended to pass. All those in favor, please signify by saying aye. Aye. Any opposed? The motion does prevail and Senate File 2868 as amended is passed. Thank you very much.
Thank you, Madam Chair. Thank you, committee.
Next, we'll move to Senate File 3439. Senator Boldon. And do you want to put your A1 amendment? Would you like to adopt that before?
Yes, Madam Chair. It's just some minor technical changes.
Senator Boldon moves the A1 amendment. Members, all those in favor, please signify by saying aye. Aye. Any opposed? The A1 amendment is adopted. Senator Boldon.
Thank you, Madam Chair and members. This is a bill about safety for our kids. Minnesota is one of a handful of states with very permissive laws on vaccine requirements for educational purposes. Our current law allows exemptions based on conscientiously held beliefs, which essentially means for any reason. It's worth noting that in 2012, 95.7% of Minnesota's kindergartners were immunized against measles, mumps, and rubella. It has steadily declined to, in 2024, going down to 87%. 30 states, including Minnesota, have reported measles cases last year. We are now the fourth lowest immunized state. We rank fourth lowest in the nation for kindergarten MMR vaccination rates, ahead of only Idaho, Alaska, and Wisconsin. Even modest declines in vaccination coverage can significantly increase the risk of outbreaks of highly contagious diseases such as measles, and we have seen that, particularly in schools and childcare settings where close contact is common. Just this year, MDH has reported 14 confirmed cases of measles, and we have seen a significant rise last year with at least 70 cases and multiple outbreaks of measles occurring predominantly in unvaccinated individuals. And so as we are in a time where the federal government is moving away from sort of scientific rationale for some of this, and there's a lot of rhetoric, we are seeing those vaccination rates decline, and in turn, we are seeing increased outbreaks. That is dangerous for kids. I also just want to be clear that there are a number of kids who, because of medical reasons, medically complex kiddos, they are not able to be vaccinated. They also deserve to be safe in school and childcare and pre-K. And so this bill would remove that conscientiously held belief exemption for the MMR vaccine specifically to ensure that we are keeping all of our kids safe from a disease that is on the rise and very dangerous. And with that, I know we have some testifiers, Madam Chair.
Thank you. And first, we'll go to testifier on Zoom, Karen Ernst. If you could please state your name for the record and begin your testimony.
Yes, I'm Karen Ernst, and I am here on behalf of myself and not of any organization today. Chair Wiklund and members of the committee, Senate File 3439 is a measured and necessary step to respond to the exploding measles outbreaks across the country. Since 1967, Minnesota children have been protected by vaccination requirements for school entry. Gradually, through 1980, all 50 states adopted similar immunization laws. These requirements are important for two reasons. First, they serve as a key health touch point, the same way that school hearing and vision screening do, supporting our healthcare systems and giving all children a healthy start to school. The requirements also make the shared space of the classroom safe and healthy for all students, keeping schools open and children learning. Classrooms are notorious vectors of illness, with 30 children spending many hours in small enclosed spaces every day. Because these spaces are special and places where viruses can thrive, vaccines truly give everyone their best shot at keeping kids in school. In 1970, a measles outbreak in Texarkana demonstrated the effectiveness of school vaccine requirements. 633 children caught measles in that town that straddles both Texas and Arkansas, but 97% of the cases were in Texas. What advantage did Arkansas have? They required vaccines for school, and Texas did not. We need stricter school requirements to keep measles at bay because it is the most infectious human virus. We don't need to look at Arkansas to learn that. We can look at the Hubert H. Humphrey Metrodome in 1991. At the opening ceremony for the 1991 Special Olympics, an athlete took the field unaware that he had measles. 2 people in the upper deck of the Metrodome caught measles from that athlete. Measles is that infectious. And now, year after year, Minnesota experiences measles outbreak. It's time to give measles special consideration and ensure that every student who can be vaccinated against it is, so that all children can stay in school. I urge you to pass Senate File 3439. Thank you.
Thank you. And next we'll go to Caitlin McLean. And I forgot to mention, but we do have quite a few testifiers on this bill, and all testifiers need to keep their remarks to 2 minutes or less. Thank you. Welcome to the committee, and please state your name for the record.
Thank you, Chair, members of the committee. My name is Dr. Caitlin McLean. I'm a physician who has the privilege of caring for children, and today I will actually work a shift in a pediatric emergency department. Today I am here representing the Minnesota chapter of the American Academy of Pediatrics, as well as the MMA. The American Academy of Pediatrics is the leading voice for children's health in our state. We proudly represent more than 1,000 pediatricians across Minnesota. Thank you for the opportunity to testify in support of Senate File 3439. Routine childhood immunizations are one of the greatest public health achievements of the last century. Because of vaccines, diseases that once caused widespread disability and death have become rare. Unfortunately, in my career, I have already seen severe childhood illness and disability caused by diseases that could have been prevented by immunization. A few brief examples: a child on a ventilator a child on a ventilator because of measles, a child who will never hear again because of meningitis, a child with numerous brain bleeds and a seizure disorder because of a severe infection that could have been prevented by a shot. These and countless other cases that we don't have time to share today are becoming more common as vaccination rates decline here in Minnesota. The risk of a measles outbreak in Minnesota is not hypothetical. It is present. It is right now. Recent reporting, as was already mentioned, shows that Minnesota is among the lowest in the nation for kindergarten vaccination rates against measles, at only about 86.5% of Minnesota kindergartners fully vaccinated. The rate that we need to be protected is 95% to maintain community immunity. Measles is a particularly nasty virus to fight, and this is something I want to impress upon you. It is highly contagious, with infected people shedding virus for days before the symptoms even begin. And it can live in the air after a person walks away for up to 2 hours. That is a very difficult virus to fight without immunization. As we are seeing right now, measles spreads quickly, especially in areas with low vaccination rates. That's happening right here, right now in the United States. We know that it can cause serious complications, especially for infants who are too young to be vaccinated, or for children and adults who are immunocompromised. This bill that we are discussing today would address this growing risk by limiting the use of conscientious exemption for immunization against measles, mumps, and rubella. These diseases are highly contagious, and maintaining high vaccination coverage in schools and childcare settings is critical to preventing outbreaks. For pediatric health, prevention has always been foundational. Vaccines not only prevent acute illness, but they also prevent hospitalizations, long-term complications, missed school days, and strain on families. Policies that strengthen protection against highly contagious diseases like measles help ensure that children across Minnesota can grow, learn, and thrive in safe environments. Thank you for your time. On behalf of the Minnesota chapter of the American Academy of Pediatrics, I respectfully urge your support on Senate File 3439, and I'm open to questions.
Thank you. Our next testifier, in person, Jessica Yudchitz. I apologize if I'm getting your last name incorrect.
Thank you so much. It is Jessica Yudchitz. Chair Wiklund, committee members, thank you for your public service. In 1986, drug companies went to Congress and Ronald Reagan and said they would soon be bankrupt because there were too many vaccine injuries. They were granted complete legal immunity for current and all future vaccine injuries by way of the National Childhood Vaccine Injury Act. Vaccines are the only product in America where you cannot sue the manufacturers for injuries. Decades later, we've seemed to have forgotten this history. Now in 2026, we are told vaccines are safe and effective, and anyone who says otherwise is full of misinformation. This is my child who almost died from a grand mal seizure after being vaccinated with the hepatitis A vaccine. Sorry, it's very emotional. My son's doctors say I should never give him another vaccine, saying he could have another adverse event, or even worse, die. They will not give him a medical exemption because of fear of retribution for their medical licenses. So please do not tell me that there is a path I can take to get a medical exemption. I have never met another mother who has been able to get a medical exemption for her child. We are not anti-vaxxers. We are members of the vaccine safety movement, Every decade in our nation's history since the colonial era has given birth to social movements that forever changed the landscape of our cultural norms. In the early 1900s, immigrant women joined together in unison to demand better working conditions in the garment factories where they toiled without rights or fair compensation. In the 1920s, photography was used to depict the cruel environments that children were forced to work in, inspiring future child labor laws. The 1960s was a plethora of struggles for civil rights, women's rights, the Chicano movement, and the environment. This bill is the antithesis to protecting children, violates civil rights, and disregards any informed consent process, promotes a dangerous precedent, and parents' rights to making medical decisions for their children. The Free Press argues that mothers are the most important force in today's political landscape. Please believe them. Thank you so much.
Thank you. And now we'll go to testifiers on Zoom. First, Katie Christensen. And again, please keep your testimony to 2 minutes or less.
Thank you, Chair and members of the committee. My name is Katie Christensen. I'm a mom of 6, including a special needs son. I'm also the Director of Disability Advocacy and Supports for Minnesotans for Health and Parental Rights. And when we say Minnesotans for Health and Parental Rights, we mean Minnesota families. We're a 100% volunteer community network. Please see our written testimony for full remarks. Minnesota's current immunization law already requires vaccination records for children in daycare, public school, private school, and homeschoolers. Families who cannot accept certain vaccines may file either a medical exemption signed by a physician or a notarized conscientious exemption. This framework has served Minnesota well for decades. It allows the state to promote public health recommendations while still respecting parental authority, religious freedom, and freedom of conscience. Conscientious exemptions are not a loophole. They recognize that Minnesota is a diverse state where families hold deeply held religious and moral convictions. For some families and faith communities, vaccines such as the MMR vaccine raise moral concerns related to their historical development using aborted fetal cell lines. Regardless of one's personal views on vaccinations, eliminating conscientious exemptions removes the ability for people of faith to follow their beliefs about why they permit to be administered to their bodies or their children's bodies. The Minnesota Constitution, the Supreme Court, and the First Amendment strongly protect freedom of conscience and the free exercise of religion. Removing exemptions places families in an impossible position. Choose between education and childcare or remaining faithful to their beliefs, which could force some Minnesotans to become medical refugees. Because Minnesota homeschool statutes rely on this same immunization law, eliminating exemptions removes that pathway as well. Medical decisions need to remain between parents, their healthcare providers, and their conscience, not dictated by the state without accommodation for deeply held beliefs or a full understanding of every single child's medical history. We fully and respectfully ask the committee to protect Minnesota families, all of them, and their longstanding rights to religious freedom, parental authority, and freedom of conscience. Thank you for your time and consideration.
Thank you. And next, we have Kathy Lindgren. If you could please state your name for the record and begin your testimony. Ms. Lindgren, we do see you on the Zoom,
Okay.
but I don't, now we can hear you.
Sounds good. It shows
Okay.
that I'm still unable to have video, but that's okay. Good morning, committee members. My name is Kathy Lindgren. I'm a registered nurse and a mom to 5. I am here independently and I don't represent the views of any medical organization today. I wanted to share with you that September 30th of the year 2000, at 4 months old, my daughter was admitted to the PEDS ICU in St. Cloud. We were told late that evening to have our family come to the hospital because we would likely be saying goodbye to my daughter. We had listened to our doctors and nurses. We put 1,000% of our trust in them. I fully believed that they were the experts. I had wonderful network of moms and friends. I did exactly what they all did. I took my kids to get their vaccines. I believed it was the right thing to do. It's amazing to me now to realize I hadn't ever done any research on either side of the vaccine argument. I just did what I was supposed to do. I did what I believed was the right thing, and just like almost every single one of us has done to start. 36 hours before the start of that 16-day ICU stay, my baby had gotten her routine vaccines, plus one more that would be mandatory next time. So I was encouraged to just start it today. She spent 16 days there with encephalitis, and we were told multiple times she may not live, and that if she did, she would be blind or deaf. And thankfully, she is alive today, but that day and those 2 weeks changed everything for me. I left the hospital that day filled with fear of the CARE conference recommendation to stop vaccinating my children, for now, they said, until we know more. Ironically, looking back at it, I can't believe I wasn't fearful at all of vaccine injury yet. They knew of my older daughter's not as severe, but still severe reactions, and around a conference table that day, we had our discharge care conference. It was that day that I learned that while many diseases can sometimes cause terrible side effects, vaccines can too. 2 peds ICU doctors, a nurse, and a social worker sat at that table while I wrote pages in my day planner of the instructions they gave us. They all listened while one doctor made a recommendation for us to stop. They listened to me ask several questions, following up about how we were going to not get polio and all the other diseases, and I was just told to follow up with our doctor at our next appointment. And oddly enough, 20 years later, when we obtained all her medical records from the hospital stay that time, there wasn't one note or one mention from anybody regarding that recommendation to stop vaccinating. No mention that this happened within 36 hours of receiving all our vaccines. No VAERS report was ever made. Nothing. And years later, as I became a nurse, I realized
Ms.
that
Lindgren, if you can
yep.
please complete your testimony, please.
Okay. I realized myself, I had followed all the requirements too. My mom got me all the vaccines, everything. She listened to her doctor's advice, followed her community. And just before nursing school, they drew my titers. And even though I was fully vaccinated, they learned I had no measurable immunity to measles. I tested negative several times. So I'm not here to tell you I'm anti-vaccine. I want to be clear, I am not anti-vaccine. I'm not anti-vaccine any more than someone with a dairy allergy is anti-cow, or someone with a gluten intolerance is anti-bread. In all these cases, we've all tried them, we all wanted them to work, and they work well for some people. Some people have minor affections, and
Ms.
they
Lindgren,
continue.
I've let you go over for a minute and a half beyond the 2 minutes.
I didn't realize it went fast, yes.
Yes.
So yes, that is all I came to say. It works for some people, it doesn't for others, and therefore, and that is a fact, and we need a choice. Thank you.
Thank you. Next, go to Heather Harstead. If you could please state your name for the record and begin your testimony.
Hello, my name is Heather Harstead, and
Ms. Harstead, if you can turn on your video,
sorry.
That's a requirement.
Oops, yep, I'm gonna try it. Okay, sorry. My name is Heather Harstead, and I'm a parent and concerned citizen here today to strongly oppose Senate File 3439. This bill strips away Minnesota parents' right to exempt our children from the MMR vaccine based on deeply held conscientious or religious beliefs, something protected for decades under state law. The First Amendment guarantees us free exercise of religion, and the 14th protects parental rights to direct our children's upbringing. For many of us, like my own family, vaccination decisions aren't just medical, they're moral and spiritual. We believe God gave us stewardship over our bodies and our children. Enforcing compliance overrides that sacred duty. This isn't about denying science, it's about trusting parents to weigh the risks and values without government coercion. The worst of all, this bill could push good, faithful Minnesotans, like myself, out of our home state forcing us to uproot our lives to move somewhere that still respects our rights. I urge the committee to reject this bill, protect parents' authority, uphold religious liberty, and let families decide. Thank you.
Thank you. Next, we have Cindy Jo Schlower. If you could please state your name for the record and begin.
Hello, my name is Cindy Jo Schlower. In 2019, I was pregnant with my first child. I was currently teaching in a Minnesota school district, and as a teacher, had many students that were not vaccinated, but had become friends with many parents in my classroom and had many conversations. I had made a firm decision upon delivery to not vaccinate my child. We had our daughter September 21st of 2019, a pure bundle of joy and health, and we requested no vaccines at birth. Fast forward to her 8-week checkup, as I was prepared to return to work to teach, we brought our daughter into her 8-week appointment so that she could start daycare. We entered the appointment with a firm decision of no, but immediately after the doctor walked in, there was a large push towards us. We were, without a doubt, fear-mongered into giving our daughter the DTaP vaccine and told that we were risking the life and possible death of our child. I began crying immediately, and we were cornered and scared with pushback. And as a new parent, we were very fearful of what the doctor could do. We let them unfortunately scare us into vaccinating our daughter. And within an hour, her temp had risen to 104 degrees. We were on the phone with many nurses' lines, and we were just told that this was normal and to give our child Tylenol. By the next day, she was completely covered in hives, and within 3 days was profusely pooping blood. Appointment after appointment, we were brushed off and told this was fine and normal, and I was told to cut out dairy as I was breastfeeding. Finally, after months of appointments in different places, different doctors, we had a doctor bold enough to tell us that she should not be vaccinated anymore. I can tell you as a new mother, this was scary. I felt helpless and felt very angry at the medical system for lying to me and fear-mongering me into vaccinating my daughter. This has to stop. Luckily, she is here, she's alive, and she is healthy. But there is cases of thousands of children that are not. And I would like to add that at home, I do have a medically complex child. He was born with HIE and a seizure disorder. And so we do not vaccinate to also protect him, but we were denied a medical exemption for vaccinating him. I also would like to add that 93% of children in the U.S. are vaccinated for the measles, and 94% of them are vaccinated in Minnesota. And there is also a 99.8% survival rate of measles for children between the ages of 3 and 5. I completely oppose this bill with every ounce of my being to protect children, protect the future of this country, and to stand up for mothers, parents, and children who feel that they are too scared to have a voice. My daughter did not deserve this. I did not deserve this as a new mother, and no child or mother should have to go through what we did. I know my children best. I have the best interest for every child and every health decision in my home, not the government, and my choice matters. Thank you so much for letting me read this today.
Thank you. And last, we have Teresa Jones. If you could please turn on your video and state your name for the record and begin.
Hi, my name is Teresa Jones. I am a doctor of nursing practice. I am an advanced practice registered nurse. I'm also a family nurse practitioner. I am not here on behalf of any organization. I am here on behalf of myself. I am a resident of Carleton County. I am a mother. I am a registered nurse. I'm a family nurse practitioner, and I'm a homeschooler. I'm writing to ask that you vote against this bill. As a health provider, one of my main roles is to be an advocate for my patients and their medical choices, what they put into their bodies and what they put into their children's bodies. The decision on whether to vaccinate is a personal one. It's dependent on a full and informed discussion with their health provider and no one else. It depends on the individual child, their health and developmental circumstances, their age, and their religious preferences. There is evidence that these vaccines were manufactured with aborted fetal tissue. If someone is wanting not to put that in their body for religious reasons, that is their choice. Additionally, for many families, it raises the moral concerns. And eliminating the conscientious exemptions leaves no avenue for Minnesota residents to follow their faith or their convictions regarding what they put into their bodies. This also brings up serious concerns under the First Amendment and the Minnesota Constitution, which protects the free exercise of religion and the right for conscientious decision-making. Medicine is not a one-size-fits-all model. There are exemptions, and it can be conscientious as well. We are uniquely and wonderfully made, and the decision should not be made by the government to coerce parents to put something into their child's body or have them under duress. Please vote against this bill. Also, from a personal note, as a registered nurse, I was pregnant and giving birth to my child. I followed all of the recommendations for vaccinations. He had several different reactions at different time intervals for the wellness child checkups. I brought these concerns to the pediatricians multiple times. No one ever recorded it. It was not reported to VAERS. At 13 months old, getting his 12-month vaccines because he had been sick, he had a seizure. He had 104 temp. He started having developmental setbacks after that time, and I brought it to the pediatrician, and he said, it's normal, it's normal, it's normal. As a registered nurse and a mother, I was a paid observer as well as knowing my own child to see that it was not normal. From that day on, he has not received a vaccination, and doctors continue to ask, well, maybe we can just give him one.
Ms. Jones, can you please finish your testimony?
Yes. If you are allergic to strawberries, does the doctor suggest that you take a small amount of strawberries to see how much you are allergic to? We should not be playing Russian roulette with our children. The parents know their child. Please oppose this bill. Thank you.
Thank you. Members, questions or comments about the bill? Senator Liskey.
Thank you, Madam Chair. This is a pretty deep subject in my world, but I'm going to start with a question for Senator Boldon. These are a couple of statements, and I'm just curious if you know where they were made. These are deeply personal decisions. These decisions should be made by a patient in consultation with their healthcare provider, not politicians. We need to listen to those with lived experience. Do you recognize those statements?
Senator Boldon.
Senator Liskey, I can't tell you where those statements were made. I think it could be a number of places at a number of times. Don't know specifically what you're referring to.
Senator Liskey.
Thank you, Madam Chair. Madam Chair, Senator Boldon, those are statements that you've made in the past, both on the Senate floor and actually just here today in committee. Why is this different? What makes this different?
Senator Boldon.
Thank you, Madam Chair. Thank you, Senator Liskey, for the opportunity to talk about this. I stand by those comments. We should be listening to those with lived experience. We should be listening to science and evidence. And we have a role in the legislature for the health and public safety of our state. And that is the focus of this bill. I certainly have empathy and compassion for everyone who has testified here today. And that's why there continues to be, there was a comment made about, this should be a conversation with a healthcare provider. That's absolutely true. And that will continue to be true under this bill. That should be. There is a reason for some children not to be vaccinated. That's a conversation that should be had with a medical provider. And there is an avenue for that within this bill. And because of that, because some children cannot be vaccinated, all the more reason that everyone else who can be needs to be, to keep those kids safe. And so every child who goes to school, pre-K, childcare, deserves to be safe in that environment. And right now, with our declining immunization rates, that is not true. There's big risks for kids and measles, and we are seeing that as we have said. That is on the rise, and as we heard today from a pediatrician who is on her way to go treat kiddos today, those are real risks that we should be taking action to prevent.
Senator Liskey.
Thank you, Madam Chair. Thank you, Senator Boldon. You're directing right to where I need to go next, which is talking to the pediatrician. So if she could come up, that'd be great.
Senator Liskey.
Thank you, Madam Chair. You stated that there were 14 cases in the state of Minnesota here, I believe, just this last year. How many of those cases were of vaccinated individuals?
So the 14 cases are, oh, sorry, Chair.
Please, Ms., no, I'm just.
Dr.
losing your name.
McLean.
Dr. McLean.
Yes.
Go ahead.
Chair Wiklund, thank you. So those 14 cases are in 2026 already this year.
Senator Liskey.
Thank you, Madam Chair. My question was, how many of those 14 cases were of vaccinated kids, or in this case, vaccinated cases in general?
Dr. McLean.
I don't have that data in front of me.
Thank you, Madam Chair.
Senator Liskey.
Madam Chair, you also stated that 86% were fully vaccinated and we needed to reach 95% for vaccination. Do you have the numbers for how many were partially vaccinated?
Dr. McLean.
I do not have that data for the state of Minnesota. The important information here is that you have to be fully vaccinated in order to be protected against MMR. 2 shots provides at least on average, 97% protection against measles. And in the state of Minnesota, most recent data is that we are only at about 86% fully vaccinated.
Dr. Madsen, did you have other data?
My name is Dr. Lisa Madsen. I'm president of the MMA. And I can tell you that we've had over 1,300 cases of measles in the country this year. There have been 101 children who have died, and 85% of them were unvaccinated.
Senator Liskey.
Thank you, Madam Chair. Madam Chair, Dr. McLean, would you not agree that even a partial vaccination would be better than a nothing in this case? I would assume that's based on your arguments that you've made. Is that correct?
Dr. McLean.
1 dose of the MMR vaccine is absolutely better than no doses of the MMR vaccine to protect against measles. That is correct.
Senator Liskey.
Thank you, Madam Chair. So I'm going to use a little bit of a personal history with myself, talking about why or where things are. I truly believe in informed consent. That's why I brought up the statements that Senator Boldon has made. Let me talk about what happened in my history. So I have had an MMR vaccine. I'm vaccinated myself. Now here's the issue. At age 5, I went in for my pre-kindergarten vaccines. I was given my vaccine, and back then it was a thigh vaccine instead of in your arm. So the issue was that I had an allergic reaction, and I actually was unable to walk for over a month after receiving that MMR vaccine. That's a pretty significant amount of time for a 5-year-old not to be able to walk. At that time, the doctors even admitted, and see, this was back when doctors were open and honest about how these symptoms and things were arising, and unfortunately, I don't feel like that's happening anymore in today's world. I was unable to walk. The doctor said, you know what, maybe it's time to slow down on your vaccine schedule. It's okay to take it, in between. I would have been defined then as a partially vaccinated child, which means that I wouldn't meet your 86% that you're talking about. I would have been in the 14%. I was still partially vaccinated, meaning that I probably made the threshold of 95% that you're looking for. The issue is, then at the time of about 7th grade, where you have to go again, the doctors decided that because I had an allergic reaction, it was not a good idea to have it at that time. But the problem is the doctor refused to sign a medical exemption for fear of losing their medical license or being demanded by the medical board that that was not okay and that would affect their license. So they instead told my parents that I had to go to school. Obviously, that would be the idea. We want kids going to school. That they had to sign a conscientious objection. That was the only way around getting no MMR that year. That meant that in order for me to go to school under this bill, I would have had to have the doctor sign it, but the doctor was refusing to sign it. So now I don't get to go to school. I don't get to get my education. I believe that's a pretty constitutionally protected thing here in the state of Minnesota, education. So here we are telling people that this is a needed bill, this is a required bill, but yet I couldn't get a medical doctor's exemption back then. Fast forward to today, we had COVID vaccines come out during COVID's pandemic, right? Well, I talked to 3 different healthcare providers because I had been ill, and all 3 of them, I explained the situation where I had been allergic to vaccinations before, and this led to each one of them saying that they refused to give me the COVID vaccine after they had just told me 2 minutes beforehand that they wanted me to get it. But guess what? I asked, okay, well, why can't I get it then? Well, because we were pretty sure you would probably have a negative reaction, and so we can't give this to you. Okay. So then can you sign an exemption for me so that I don't have to have the COVID vaccine? Because of course back then it was talking about you needed it to go places. You needed your COVID vaccine card to prove that you had it. and yet they refused to sign it for me. So now not only am I stuck in this mandated world that this bill would create, I can't get an exemption. So which is it? Either we trust our doctors, who my doctors said that I shouldn't get it, but then they won't give me an exemption. So I don't understand how we're going to handle this bill, because you say there's still a loop or a gap here, but there isn't anybody willing to do it. I had 3 different providers that refused to sign the exemption. So with that, I urge a no vote here. And I do believe that this bill also needs to go to education policy after being here. So just making sure that that's going to happen. Thank you.
That's the destination for this bill, would be education policy. Senator Abler. Senator Udke.
Thank you, Madam Chair. And my first comment is a little tongue-in-cheek, but thank you for filling up my email inboxes, because it's just been absolutely crazy with emails coming in. And not that I see every last one of them, but I have yet to see one that was in favor of the bill. They are all against it. Parents want choice, and parents know best what their children need and should have and all of this. So, you know, as I see this, this proposed mandate would, at least the way I take it, would not increase our percentage of vaccinations out there, because parents are going to push back. Parents are going to leave the workforce because one of them is going to stay home and take care of their kids, because if they're not allowed to go to daycare, et cetera. When it comes time for school, they're either going to homeschool or go to some other source of schooling that doesn't require this. Public schools are going to lose out. So our workforce is less, our public schools are going to be less. And, you know, it just kind of goes back to, anytime we force people to do something, they're going to push back even harder. If there's anything that we could do, is the educational part of it. You know, what people do need, what the benefits are, but then also we've heard a lot of stories about those that have the adverse reactions, that we have to fully recognize that does happen, and we have to make sure that there's a path forward for them also, and that they aren't just kind of shunned and set aside for the rest of their life, and they continue to have these questions and problems as they age. And so I just see a mandated process like we're looking at in this bill is just totally going the wrong way. I feel we're going to go backwards, and I would fully ask everybody to say no to this, and let's put some common sense back into the equation. So thank you.
Thank you. Senator Mann.
Thank you, Madam Chair. Thank you, Senator Boldon, for bringing this bill forward. And to answer Senator Liskey's earlier question, the vast majority of those 14 were unvaccinated. 12 were unvaccinated and 2 were not fully vaccinated. So nobody was fully vaccinated out of that 14. And this has been the case with measles cases across the country, where the kids are not vaccinated or not fully vaccinated, and where children are being hospitalized and losing their hearing and having long-term sequelae from this, and are dying from diseases that are fully preventable. You know, I think in America it's especially interesting because as people are losing access to their doctors because they can't afford to go to the doctor anymore, they are turning to other people, to YouTube influencers or to their friends, or they're doing their own research when it comes to not only vaccines but other medical issues as well. The number of times that I have seen in the ER someone come in with something that was either preventable or easily treated, and the advice they got from somebody else was so off the mark that it caused more harm, is astounding. It's happening more and more as time goes by. And I don't know, I honestly do not know where people are finding providers that are refusing to sign medical exemptions when there is a clear medical exemption. You will not lose a license if you sign medical exemption. So this idea that they're afraid to sign it because they're afraid of losing their license, it's not reality. It's not reality that I'm a part of whatsoever. So again, it is our duty as the state to protect people. It is upon us to uphold public health. And I know that, again, as a country, we don't appreciate public health, we don't understand public health, we don't invest in public health, we don't fund public health, we don't research public health. And so what happens is we have all these things that could have been prevented and that are not. So thanks again.
Senator Abler. Senator Abler, we need to finish up this bill, and so we are going to move forward with people who haven't spoken.
Well,
Senator Abler.
Well, welcome to spring. I don't know how many debates we've had about this, quite a lot. And I'm not going to question the intent of the author, who I have a lot of respect for. I may suggest the process is a little curious. I'm not sure how this bill even gets through deadlines. But here we are, discussing this. I have a career in 47 years, and I'm not anti-vax. I'm pro-informed consent. That seems to be a novel approach, and the dogma of, no, it's fine, and ignore what happens, I've heard hundreds of times. I met with a group of Somali parents a couple of years ago, and it wasn't like, don't get vaccinated. They just told their stories. One woman came in complying with the pediatrician, trying to be a good mom, and so she had 4 kids and took one in to get vaccinated, and the kid became nonverbal. I'm like, oh, not to worry. Well, that happens. And so she brought the second child in, literally, like the next year, and that kid became nonverbal. She decided she was not going to vaccinate the 3rd and 4th kid. And so my problem with all this is I read and I accept information. And if you want to get a vaccination, go get one. The doctor and the nurse practitioner and my good colleague, Dr. Mann, should sit down with you and have a serious conversation on the whole topic. And so I've got discussed, there's books around, and they're not all written by crazy people. They're written by doctors, real doctors, medical doctors who actually have degrees, who actually see patients, who actually know how to take in information and have a rare independent streak. The world has become much more corporatized for healthcare. In Alina, you got to do what they say. They're very frustrated there in my area. And so corporate practice of medicine is not helping. And so this doctor says, just because I think you need an antibiotic for a virus doesn't mean I'm anti-antibiotic. That's this take. So this person has looked at all sides. And after reading this, you might want to get a vaccination. But like the one mother said, I never thought about it. This book talks about informed consent, which we're for, except when we're not for it. This one talks about critical vaccine studies, and it says, gee, they're not as safe as you think. Mr. Osterholm with the COVID vaccine, he said, it's as safe as aspirin. He's wrong. He's wrong. And so the vaccine court, it's very hard to get a case paid for here. The bar is very high, but there have been thousands and thousands of cases that they paid for where people were not fined after the shot, where they had to go through heroics to get paid. It's not as safe as you think. This is written by an MD back in talking about thimerosal, which was used in multi-dose things, which actually was really like poison. This one actually, this vaccine injuries, talks about data analytics, and there's one chart that I'm going to show you. This is a chart of measles deaths, starting in 1900 and all the way up to 1970, and it declined. And then the measles vaccine started here. And people go like, oh, look, it's reducing from there on. I mean, maybe it helps. But they were declining anyway for all kinds of reasons. And then finally, the next bill up is going to be requiring you to get a DPT shot. This is a DPT, a shot in the dark. Chapter 2 is forgive us for your death. And so if the people, you listen to the ads on TV about the different medicines you can take. And there's here's the people happily walking in the park. And by the way, So if you feel suicidal, or if you have a liver attack, or if your stomach starts bleeding, tell your doctor. Every drug's got a side effect. And inform the people. And, you know, Madam Chair, just to the people, there's a reason that we're a republic and not a democracy. Because there is the tyranny of the majority. And the majority today probably is going to vote this thing out of here. Maybe you counted, Madam Chair. But there are also people that have rights. And in a republic, people have rights. And so blacks, I think, are 11% of our country. We could vote them no rights. But no, you could not, because there's a constitution and there's amendments, and we all agree they should have rights, for heaven's sakes. And so we got to be careful. And I just want to point out, we debated for 14 hours the topic of abortion. And if there's ever been a slogan in abortion, it's been my body, my choice. I think that comes up a lot. Except in this case, it's, you know, it's your body, my choice. And I just think that's absolutely wrong. And the parents who can seriously consider the issues for their children do not do it in a cavalier way. They don't do it to harm anybody. And the herd immunity that you have to have. And so for the sake of a few, some must die. Really? That's actually said by people. And I just, I don't think you want to go there. And the people speaking, I hope anybody in this committee listen to those testifiers. They're not paid. They're not going to make a lot of money like pharma is if this goes forward. This is in 25 states now, this very topic, right now. Not spontaneous. And so I caution everybody. So I'm going to be voting no, because I think that parents and patients and doctors should actually have a free way to do things. And Senator Liskey is not wrong where people are not willing. Your clinicians, maybe you are a doctor. But it's not like that. And there is great fear. And I think particularly Alina, where I've heard of those doctors, they're afraid to do what they think is right. COVID being an example. So I guess I'm a no, Madam Chair. Thank you.
Senator Fate? No? Senator Liskey, I know you wanted to say something, but Senator Cran hasn't spoken yet. Senator Cran? Senator Liskey?
Thanks, Madam Chair. It's very brief. To list off the 3 places that I went that were told me no on getting a medical exemption was Northfield Hospital and Clinics, M Health Fairview, and Park Nicollet Clinics. Thanks.
Senator Cran?
Thank you, Madam Chair. And I think between Senator Liskey and Senator Abler's testimony, I think it's pretty clear. Our families want choice. And I think, you know, when you look through the information, I can only find 3 deaths, not to minimize any death. But I think one of our testifiers, we don't have the names of any of your testifiers, but on the left, one of the testifiers said 101 deaths. I can't find that statistic anywhere. Through 3 different sources, I can't find a statistic. I find three deaths that occurred, first 3 deaths in 10 years.
Dr. Manson, just, you need to wait until, so
Chair,
is that your question?
Yeah, we have 3 recorded deaths in the last 10 years that I can find through any source. And so I'm kind of curious, where did the 101 come from?
Dr. Manson.
Thank you, Madam Chair. Thank you, Senator. I have to admit, I did misspeak. That was on flu deaths. There have been 101 flu deaths out of, and 11 children died just last week. So that is where that comes from. We are seeing an increase in congenital measles, which I've never seen in my career as an obstetrician. And that's when a mom gets measles during pregnancy and passes it on to her child, and that child will have disabilities for the rest of its life.
Madam Chair.
Senator Cran.
Yeah, and so there has been an uptick, and then so you look and I'm just trying to find, I'm not a doctor, I've been told I'm not a doctor, but we all participate in this process, and we're also have a lot of common sense when we look at issues that are presented before us. And the same falls true from those that don't, right, either large segments where outbreaks occur, have still been consistent over time, and it's either religious, right, beliefs, cultural beliefs, and we have all of those things that we have low participation in vaccines. But they also have a right to not, I think it'll be ruled unconstitutional, and that conscientious objection will prevail. So I think it's the wrong direction. I mean, I think the mention of we should trust the doctors, I wish we were back in an environment where doctors worked for us. They don't work for us anymore. They work for a healthcare system. And we've seen, right, trust us through COVID. It comes back to that trust, and it was a blind faith. And so we can respond to, or we can highlight a wide variety of sources of medical institutions that all got behind it, with or without choice. And we saw doctors attacked for providing information based on their educated opinion. Senator Abler just highlighted a bunch of conflicting opinions by doctors. And so do we have trust that the system, I think many fear that. Who's making that decision and driving those decisions all across the board? Big Pharma we know have, probably sitting in this room as well. They have great influence, and it's certainly impacted every element of our healthcare system. And so I think this is the wrong direction. I think, of course, like everything, we have to continue to focus on those areas. If it's proven great value, to build that trust in those communities that don't trust it today. And the conscientious objection, I think, must prevail. So I'll be voting no on this bill as well. And I would hope that it doesn't pass out of this committee, because it's just going to end up with more expensive litigation for parents to have the rights that they've been granted since the 70s. So thank you.
Thank you. Any other member questions? Senator Abler.
I won't go long, but I just wanted to point out, I think about there are families who just don't want one, but they have no choice. They can't afford a private school. They don't know that they want a homeschool, and they're just going to be coerced to do that. And it's just, and so some are going to, it just bothers me. Just that article about the flu deaths, 15 of those deaths were fully vaccinated. So nothing's bulletproof.
Right, 85% were.
Yeah, so that's about that. But one thing about the measles thing, I remember reading about that, it kind of wears off. And so sometimes it's timing. And there's so many vaccines given at a young age that the child is not prepared to take. And even relaxing the schedule now takes a little courage. And so this is why you want to have a chance for the doctor and the family to interact. If they want to get the vaccine, God bless you, get it. But like the young mothers, I remember reading that since it wears off after a decade or so, that we should be maybe considering vaccinating more 15-year-old women to make sure this congenital thing doesn't happen, when actually it is a real risk and a real problem and a whole lifetime of challenge. So there's room for thoughtful discussion here. But this one size fits all is just wrong. So I'll stop, Madam Chair, but thank you for the opportunity.
Any other questions? Or Senator Boldon, did you have any other comments to the?
Do we have time, Madam Chair?
If it's a brief response, Dr. McLean.
I would love to. Thank you so much. I just want to thank the discourse on this. I know how deeply people feel about this issue. And something that I like to say when I'm talking to parents, because this is an important part of my job as a pediatrician, is to talk about vaccines and vaccine hesitancy, is that everyone is always trying to do the best for their child. I don't think anyone goes into these conversations trying to harm children. I think we can all agree on that. Everyone having this discussion is trying to protect children. And so I want to make sure that you all know that I see that we're all aiming for the same outcome here, which is safe and healthy children, because it can start to feel very contentious, right? Like we think that opposing parts of this argument are trying to harm children, and I don't want you to think doctors want that, because we want safe and healthy children, and parents who are worried about poor outcomes also want safe and healthy children. I agree, there is room for discourse here. The reason we're talking about purely removing the conscientious objection for just MMR and not the whole schedule, just this one, is because of the current very high risk of adverse outcomes for measles. 1 in 100 kids will get pneumonia. 1 in 1,000 kids will get an infection in their brain. Children will die. Approximately 1 in 1,000 that is infected will die. That is a very real present risk for the children of Minnesota. And if we don't, as people who hold power, intervene, with almost certainty, I'm afraid that we will come back to discuss this next year with much more staggering numbers. And I think we have to do what we can to prevent that. And to your point, the reason this is different than one person making one choice about their body is that measles is so contagious that one person is making a choice about the health of their entire community when they choose not to do this one vaccine. It is so contagious. It lingers in the air for 2 hours. Think about what that means at the Mall of America. One child that doesn't know they are infected goes to Nickelodeon Land and leaves, and think about how many people that can impact, how many children can be sick. Somebody talked about the survival rates for ages 2 and up. What about the newborns? People will die, and we can prevent that together.
Thank you. Senator Boldon.
I will leave it there. Thank you, Madam Chair.
Okay. Members, Senator Boldon, I appreciate your bringing this bill forward. I do think that we are at a very dangerous and significant place, and I think we need to do what we can to encourage and increase the fully vaccinated rate. I think it's not only a safety and prevention of harm. Measles is such a severe disease, and it also is, it has a great economic impact on our country. The lower adoption rate of vaccines is going to have a very severe impact, economic impact on our state and others. If you think about childcare, if a child infected with measles is attending childcare, that childcare has to shut down for like 10 days. And, it really, I think we need to think about that as well, because it's putting kids at risk. It's putting people's livelihoods at risk as well. So I will be supporting the bill. Members, if there aren't other questions or discussion, I'd like to move forward with the vote. Senator Boldon's motion on Senate File 3439 as amended be recommended to pass and referred to the Committee on Education Policy. All those in favor, please signify by saying aye. Aye. Any opposed?
No.
The motion does prevail, and Senate File 3439 as amended is passed and referred to the Committee on Education Policy. Need to look at the clock here. We've got some bills that we wanted to finish before 10:30, and then we will be returning to the rest of the agenda at 5:30, and committee administrators checking because we need to make sure that our authors are available. Okay, now we will move to Senate File 4388.
Madam Chair, to your bill.
Thank you, Madam Chair. First, I have an author's amendment that I believe is a technical amendment that I would like to adopt. And Ms. Huffman-Litchie, if you could confirm that it's technical changes to clarify the bill language.
Madam Chair, members, yes, this is just changes that I noticed as I was reviewing the bill.
So I'd like to adopt the A1 amendment.
Senator Wiklund moves to adopt the A1 author's amendment. All those in favor signify by saying aye.
Aye.
All those opposed? The amendment is adopted. Senator Wiklund, to your bill as amended.
Thank you. Senate File 4388 is a proposal that seeks to strengthen our children's mental health service continuum and remove barriers to accessing intensive mental health models to address the ongoing crisis of children boarding in hospitals, detention, and with counties. It's a policy-only proposal that does a few things that I will just touch on briefly. It codifies the Early Childhood Mental Health Consultation Grant. It eliminates barriers for highly acute children to be cared for in appropriate settings. It builds further alignment across community-based mental health. It allows direct access to skills training to support children and their families with mental health symptoms. And it updates the Youth Act language to expand impact of this team-based service that helps children with acute mental health needs stay in the community. And I have a testifier here, and I'd like to turn it to her.
Welcome to the committee. Please introduce yourself and proceed.
My name is Shannon Brown. Thank you, Madam Chair and members of the committee, for the opportunity to testify in support of Senate File 4388. As I said, my name is Shannon, and I'm the CEO of Fernbrook Family Center and the board chair of Aspire Minnesota. We are grateful to Chair Wiklund for leading on Senate File 4388 and grateful to this committee for your support to develop the children's mental health continuum in this time where need continues to exceed capacity. We continue to see children boarding in hospitals and detention centers because the services they need do not exist or they do not have capacity to serve them. These are children who need more than 1 hour a week of psychotherapy at an outpatient office. These are children who need intense skills training 12 or more hours per week. They need expansive wraparound services like Youth Act. They may be able to avoid boarding later in life by accessing services available through the Early Childhood Mental Health Grant earlier in their life. The Early Childhood Mental Health Consultation Grant allows us to get kids into services sooner. It reduces barriers for families, and it provides consultation to child care providers who are caring for these kids daily. These services work. Fernbrook has countless success stories, and I will share one with you today. We recently had a 12-year-old client who came to us for stabilization after boarding in a hospital for 3 weeks. Caregiver was a single mother with 3 other children at home, and this child had assaulted her and one of the younger children. He was urinating in bedrooms throughout the house at night. She had to quit her job. He was running away from school. He had experienced a traumatic brain injury as a child, therefore had complex medical needs. No one knew what to do and no one had capacity to serve him. He stayed in the hospital for at least 3 weeks while the system tried to figure out what we were going to do. We were able to find a residential treatment center placement for him that could keep him and his family safe, provide intensive services to address his medical and mental health needs, and create stabilization. After successful discharge from this placement, he is now receiving skills training 16 hours per week. His caregiver is receiving family skills training. He's back in school. He and his support team are learning the skills they need to help keep him in his home and community. Serving these kids is complex and requires a team of professionals. The language in this bill will expand the kinds of professionals who are able to contribute to the valuable team-based care of Youth Act and will allow these teams to deliver care to the age range they are competent with. These services are a crucial part of building a mental health system that keeps children in their home and community while treating their mental health conditions and supporting the caregivers who care for them every day. Thank you.
Members, questions? Senator Aki.
Thank you, Madam Chair. Madam Chair, I would like to offer the A3 amendment.
Senator Aki offers the A3 amendment to your amendment, Senator.
Thank you, Madam Chair. Members and Senator Wiklund, this amendment is an amendment that addresses a couple locations of the certified community health and behavioral health clinics, and they happen to be located down in Senator Jasinski's district, so he's the one that brought this forward. But when the rebasing got changed from 3 years to 2 years, these 2 facilities got caught up in that rotation. And so with this amendment, it just would bring them back into the rotation like everybody else. Their rebasing would be on schedule and everything would be good going forward. And I believe it's in the amendment. The fact is, it specifies a strict date from January 1st of 21 through January 1st of 22 because they happen to get caught in that void. So with that, and I think, Madam Chair, I think Senator Wiklund's fully aware too, correct?
Senator Wiklund.
Madam Chair, Senator Utke, yes, I did have discussions with the stakeholders about this, and it seemed like a good solution. So I would take it as a friendly amendment.
Any other questions on the amendment? On the motion to adopt the A3, all those in favor signify by saying aye.
Aye.
All those opposed? A3 is adopted. Members.
Madam Chair,
Senator Wiklund.
I have the A2 amendment that I'd like to offer.
Senator Wiklund offers the A2 amendment to your amendment.
And this amendment is meant to establish a unique provider type so that we can take the next steps in the CCBHC model's continuation in Minnesota. It identifies a clinic as a unique specific clinic model in our Medicaid program and would remove administrative confusion and barriers, and it would streamline state licensing and certification requirements. So I'd like to move that.
Discussion on the A2. Senator Abler.
Well, thanks. I have no concern about the idea, except that DHS isn't really good at doing much these days for reorganizing things and setting up stuff. This bill asks them to do 2 new things, and I just hope they can, and I hope that they can do, like, you know, we were in the middle of housing stabilization, recuperative care, and all those, and I'm not going even to a fraud thing. It wasn't well designed. The design was horrible, and they should have known better. So I hope this works, but when I was talking with some of the staff at DHS, I said, why don't you offer nothing new this year and make what you have work? So I wish you success in this, and hopefully they can pull it off. I'm happy to support the amendment. Thank you.
Madam Chair, yeah, I mean, we have requested feedback from the department. I think if we hear, you know, other concerns, or if they'd like to have additional language changes, we can work on that. It does seem like this would be a way to try to head off some of the administrative issues that we've seen, so.
On the motion to adopt the A2 amendment, all those in favor signify by saying aye.
Aye.
All those opposed? The A2 is adopted. Senator Wiklund.
Thank you, Madam Chair. I don't have any other further remarks.
Any other discussion on the bill as amended? Seeing none, we will lay over Senate File 4388.
Thank you.
$29.75.
30 minutes. Senator Port, you have the bill Senate File 2975.
That's correct.
Senator Port.
Thank you, Madam Chair and members. This is a bill to create the licensure for music therapists. And I think we've heard several licensure bills over the course of the last couple of weeks. This is another one where, as this practice grows and becomes more popular, as it has across the state of Minnesota, it's critical that clients and patients understand what they're getting and what they can expect from a trusted provider. I'd like to have my testifiers speak a little bit more to the specifics.
Thank you. And first we have, is it Kayla Schaefer? If you could please state your name for the record and begin.
Thank you, Chair Wiklund and committee members. My name is Kayla Schaefer, and I'm a board-certified music therapist. I am the Child Life and Music Therapy Manager at Children's Minnesota, a music therapy internship director, and a private practice owner. I'm here to express my support for Senate File 2975, which would establish state licensure for board-certified music therapists. In 2025, Children's Minnesota Music Therapy Team alone delivered 4,000 sessions for our patients. These were patients on our inpatient mental health unit, in our partial hospitalization programs, in our emergency departments, on our medical surgical units, and in our intensive care units. The services my team and I provide help our young patients and their families find ways to cope in the hospital setting by expressing themselves through music. We work to help them feel less isolated and support families during some of their toughest moments, including end of life. Several years ago, while working as a music therapist at Children's Minnesota in St. Paul, I received a consult for an infant in the NICU with a significant hypoxic ischemic brain injury. She demonstrated minimal responsiveness to environmental stimuli. When I met her for the first time, she was being held by her mother, resting closely against her. I began quietly humming and singing her name, monitoring her physiological and behavioral cues for tolerance. Within 30 seconds, she turned her head toward the sound, trying to locate the source, one of the most notable responses she had shown in her life up to that point. This infant remained hospitalized for nearly 2 years due to the complexity of her condition. Music therapy became part of her daily routine, supporting her comfort, her developmental needs, family bonding, and ultimately, end-of-life care. I was present on the final day of her life, singing her preferred lullaby while she was again held in her mother's arms. As I began the familiar song, she lifted her hand toward her ear, as if attempting to hear me more clearly, demonstrating once more a meaningful response uniquely elicited through music. In addition to the emotional support our team provides, our work has also been linked to positive health outcomes, especially for our NICU patients. Specific evidence-based music therapy interventions continue to be implemented in our NICUs and have been found to decrease length of stay, decrease readmission rates, increase tolerance to stimuli, and increase tolerance to feeding. Music therapy plays a critical role in healthcare. State licensure for music therapists is a vital next step for our profession, as it would provide clarity for employers, case managers, and other decision makers who rely on state regulations to determine documentation and billing processes for healthcare services. This clarity would help to avoid financial or programmatic barriers that would impact access to care and ensure that patients can benefit from the services music therapists provide. Thank you to Senator Port for your leadership on this bill, and thank you, Chair and committee members, for your time.
Thank you, and welcome to the committee. If you could state your name for the record and begin your testimony.
Thanks, Madam Chair and members of the committee. My name is Erica Rupp. I am a board-certified music therapist, a Minnesota business owner, co-chair of the Minnesota Music Therapy Task Force, and served as president of the Music Therapy Association of Minnesota for 6 years, from 2020 to 2025. I have worked with legislators and state agencies on music therapy legislation in Minnesota for over a decade. I respectfully ask for your support of Senate File 2975. At its core, this bill is about protecting Minnesota consumers and improving access of care. Across Minnesota, music therapists are already serving families and communities throughout the state. Based on a survey, there is at least one family in every Minnesota county currently receiving services from a board-certified music therapist. This demonstrates both the existing demand for services and the statewide impact music therapy already has on Minnesota families. However, Minnesota currently does not have any regulation for music therapy. Because of this, individuals without the nationally recognized professional credential may represent themselves as providing music therapy services. This creates confusion for families, healthcare providers, and the public who reasonably assume that someone is using the title music therapist meets a verified professional standard. Senate File 2975 addresses this issue by establishing licensure and title protection, ensuring that when Minnesotans seek music therapy services as an allied health profession, they can clearly identify qualified professionals and have confidence in the services they receive. This bill also increases access to service across Minnesota. Many programs that operate with state oversight, including special education programs, Medicaid waiver services, and private insurance systems, often require some form of official state recognition of a credential before professional services can be delivered or reimbursed. Without the recognition in Minnesota law, families and organizations seeking music therapy services often encounter barriers. This issue becomes even more significant in rural communities, where healthcare organizations and school systems frequently require state licensure before contracting with providers. As a result, Minnesota music therapy businesses like mine are often unable to expand services into communities that are actively requesting them. Across the country, 30 states have a form of regulation, including North Dakota in 2011, Wisconsin 1998, and Iowa in 2021. And of those, 17 of them already adopted music therapy licensure, recognizing the importance of protecting consumers and creating clear professional standards. As a few of you have mentioned in our brief meetings over the past decade, there's peace in the valley, as Senate File 2975 is a common sense form of regulation that increases access to services, protects the public, reduces confusion, and ensures Minnesotans can identify qualified providers when seeking music therapy services. On behalf of the past, present, and future Minnesota music therapists and many Minnesotans who benefit from music therapy services, I respectfully ask for your support of Senate File 2975. Thank you for your time, and I would be happy to answer any questions.
Thank you. And Mr. Schwartzberg, and we are running short on time. If you can keep your remarks brief and to unique things that maybe haven't been stated already. Thank you.
Thank you, excuse me. Thank you, Madam Chair, and distinguished members of the Senate's Health and Human Services Committee. My name is Dr. Todd Schwartzberg, and I'm a board-certified music therapist, working as an assistant professor and clinic coordinator in the music therapy program at the University of Minnesota. I am also the immediate past president of the Great Lakes region of the American Music Therapy Association and serve as the co-chair for our Music Therapy State Task Force on Licensure. I'm a resident of Shakopee, and I'm speaking to you today in support of Senate File 2975, establishing a license for board-certified music therapists in Minnesota. This bill will increase access to our healthcare profession, protect against the unlicensed practice and misrepresentation of music therapy, and formally codify the profession of music therapy in Minnesota. Over the last 28 years, I have worked in clinic settings such as, but not limited to, nursing homes, public schools, hospitals, and in the on-campus music therapy clinic at the University of Minnesota. I've had the privilege of working with older adults presenting with Parkinson's, Alzheimer's, traumatic brain injury, stroke, and multiple sclerosis. I've worked with children with cerebral palsy at Gillette Children's Hospital, autistic children and adults, and bedside and hospice care. The profession of music therapy is well established and adheres to evidence-based practice, centering the needs, strengths, preferences of our service recipients, and integrating the clinician's training, expertise, experience within best available supportive research. I am honored to have the opportunity to speak to you today alongside my colleagues and to get to represent the nearly 380 board-certified music therapists across our state. I am also very humbled to get to advocate for the many music therapy recipients that we serve in every county across Minnesota. Both the University of Minnesota and Augsburg University have had undergraduate and graduate degree programs in music therapy since the mid-1970s, and both programs graduate between 10 to 15 music therapists each year. Minnesota is also home to several nationally accredited music therapy internship programs. Because our national board certification credential is not codified in Minnesota, there is confusion from employers, case managers, and other decision makers who rely upon state regulations to make their healthcare and reimbursement decisions. This has led to confusion and either a lack of continuity of care or a financial and programmatic barrier to healthcare services. We are by no means attempting to regulate other professions or require other professionals to cease from integrating music into their scope of practice. We simply want to ensure the public has access to our healthcare services and is protected from the unlicensed practice of or misrepresentation of the music therapy profession. We also have support from a myriad of stakeholders from across Minnesota, including family members who have received and or are receiving music therapy, organizations and employers of music therapists, and practicing board-certified music therapists from across Minnesota. This proposed legislation would formally recognize, define, and codify our clearly defined education, professional competencies, and scope of practice, and aligns with our existing required national board certification. Our service recipients, students, colleagues, and I thank you for your time, attention to, and support for this bill. We are seeking and we appreciate your support of Senate File 2975, the creation of licensure for board-certified music therapists in Minnesota. I, along with my colleagues here, are available for any questions you may have.
Thank you. And before we go further, Senator Port, you had an A3 authors amendment.
I do. I know it's long, Madam Chair. It's long because the statute number changed from last year when this bill was dropped to this year. So it needed to be updated in all of those places, and we pushed the date out. But yes, it is an authors amendment.
Senator Port moves the A3 amendment. All those in favor, please signify by saying aye. Aye. Any opposed? The amendment is adopted. That concludes the testimony. Members, do you have questions? Senator Udke.
Thank you, Madam Chair. And a couple things that I saw in the bill that would just like to find out a little bit more on. And that one was the advisory council doesn't expire. Just wondering if that's fully intentional. In a lot of cases, they do expire after a number of years, or at least get revisited so that they stay relevant. The second piece was when I saw that the CE credits, 100 hours every 5 years, that's a lot. I have a license and a certificate, two different groups that I need CE credits on, and we're talking usually around 20 hours or a little bit more every 2 years. That seems to be still a fair amount to keep track of. The 100 seems like a lot. You're looking at 20 hours a year. So just two of the things that jumped out at me and wondering why they are the way they are.
Ms. Rupp or Mr. Schwartzberg?
Madam Chair, Senator Udke, thank you for your questions. I'll address the continuing ed credits first, if you don't mind. That is the standard for our certification board for music therapists. That's required for all music therapists across the entire country and is not flexible. It aligns with other allied health professions as well. So what we're asking Minnesota to do is recognize that certification board of music therapy requirement, the 100 continuing education credit hours every 5 years, which I agree it is a lot, but as a practicing music therapist and professor, I feel like those that we get to serve deserve no less from us. But thank you.
Senator Udke? No. Senator Abler.
Just one question about the scope. And so you're protecting the title, many titles, including music therapy. Is anybody who does music therapy but your board people and it's going to care about that?
Senator Port.
Thank you, Madam Chair. Senator Abler, we don't have any opposition to this.
Yeah,
Senator Abler.
sure. Because when we fence a term, it matters sometimes. And I don't have anybody either. I just thought I'd ask. Thank you.
Any other questions or comments? Any final comments, Senator Port? Well, I appreciate your bill, bringing the bill forward. I appreciate the advocates, the really hard work that has gone into this over the past several years, many years, and that we've gotten to this point. And I think it is something that the public will benefit from. Those receiving the services will benefit from. And I appreciate all the work that's gone into it. And this bill we will lay over. So Senate File 2975 as amended is laid over. Thank you. And now we are going to finish Senator Port's bill, Senate File 3970, before we break for today. Senator Port.
Thank you. Madam Chair and members, thank you for hearing Senate File 3970 to create greater protections for children with transfer of permanent legal and physical custody, TPLPC, permanency solution, and improve access to extended foster care supports for young people. I would first like to take up the DE, which is the A2, I believe.
Members, you have the A2 in your packet. Senator Port moves the A2 amendment. All those in favor, please signify by saying aye. Aye. Any opposed? The A2 is adopted. Senator Port.
Thank you, Madam Chair. This DE focuses on policy-only solutions that will make meaningful improvements for youth with TPLPCs and improvements for all children eligible for extended foster care supports, including minor technical improvements. It will require that children in foster care who are 14 and older complete an independent living plan to support planning and consideration with the young person for their future. It will allow people who are eligible for disability supports to choose to remain in extended foster care if they prefer. clarifies that extended school time as part of disability support sustains eligibility for extended foster care, and adds Minnesota paid leave as an eligible activity for a youth in extended foster care. It allows youth who have gained TP-LPC as their permanency option within 6 months of turning 18 to be eligible for the extended foster care supports. And it adds accountability, requiring that when a young person is terminated from foster care, that DCYF commissioner also receives a notification. These provisions will improve support for young people as they transition to adulthood. And I must also note that as the Office of Ombudsperson for Foster Youth reports in your packet describes, the TP-LPC permanency option is one that requires additional work from this body, as children with these the TP-LPCs are by definition more vulnerable due to a lack of full legal standing. So this is just one portion of it. And with that, I will turn to my testifiers.
Thank you. And Ms. Hunt, if you could please state your name for the record and begin.
Yeah, I'm Karina Hunt. Thank you, Madam Chair and committee members. I'm sharing a portion of a testimony from Kwame Verser, who's not able to be here today. I spent most of my childhood in and out of foster care, starting at age 7. I aged out of foster care as a warder of the state in 2020. In my last year of foster care, I bounced around many different places, including group homes, youth shelters, and lastly, St. Cloud Juvenile Detention Center when the county couldn't find me a home. I wasn't allowed to leave St. Cloud until I aged out at 18. I experienced all of these placements even though my uncle's home was available, and I eventually went to live with him after I turned 18. As I was reaching adulthood, my worker explained the extended foster care program to me. My uncle would receive a stipend check and give me a portion of it, but I never received any of my stipend while I was living there. Shortly after I turned 19, while I was still finishing high school, my EFC worker said I couldn't stay with my uncle anymore. This made me homeless until they eventually homed me with someone who was looking to become a foster parent. After a short period of time, he decided not to foster me anymore, and I was once again homeless. But I wasn't supported as much in finding another place to live this time. I stayed in a lot of different places after this. I mostly stayed outside, sleeping under bridges, in parks, and occasionally with friends. This was all at the height of COVID when I was supposed to be finishing high school virtually, but I struggled to stay connected. I never heard from my worker during this time. I knew I had diabetes, but I was medically neglected throughout my time in foster care, so I never learned how to manage my care. My group homes in St. Cloud knew I had diabetes, but offered little help. It wasn't being properly prioritized. After years of medical neglect, I was starting to lose my sight, my weight, my teeth, and many other things. This made it really hard to stay engaged in class. I was showing up, but I couldn't see the board or a lot of what we were working on. I would spend a lot of my days at school in the staff offices getting one-on-one help. But this meant I was technically absent from class, and my EFC worker said I wasn't going to school enough to get my stipend. They said I could split my required hours between work and school, so I started working. I was going to school during the day and working 4 p.m. to 2 a.m. most days to stay eligible. I wasn't getting help with transportation, so I had to take the bus to work and school. Navigating a complex bus schedule across cities while losing my sight was not easy, but I was doing it. I managed to get my attendance at school back in good standing. I sent this to my EFC worker, hoping this would re-qualify me to receive my check. They said I needed to show 1 more month of good attendance, then I would get my check. I was able to stay in school, and I eventually graduated not long after this, but I never got an EFC check again. I'm still not clear on why. I've heard that I was in fact never in foster care. I've heard that because the 6 months prior to my 18th birthday weren't consecutive in foster care, I wasn't eligible. I've heard that because I lived with my uncle, I wasn't eligible. I'm now considered legally and medically blind, with about 10% of my sight remaining. I've been denied Social Security. I don't have insurance because I'm not eligible for medical assistance for foster youth. I've put off cataract surgery and other necessary care that could seriously improve my life. I know I will probably never get a real answer about why I was not allowed back in EFC once I met the school requirement. I can only imagine how different my life would be now if I had been financially, emotionally, and physically supported during this time transitioning out of foster care. And I hope that using my voice will help create a better system for the foster youth that come after me, especially those who are navigating complex medical care and disabilities. This bill is an important step forward for youth like me. Thank you to Senator Port and Representative Hicks for bringing attention to these issues, and thank you to the committee members for having me.
Thank you. And then we have Ann Broskoff on Zoom. And in the interest of time, if there's a way that you can keep your testimony as brief as you can, I'd appreciate it. Thank you.
Sure will. Good morning. My name is Ann Broskoff, and I'm the Brown County Director of Human Services. Chair Wiklund and members of the committee, thank you for the opportunity to testify. I'm here today on behalf of MAXA. Counties appreciate the legislators' continued commitment to strengthen support for young people who have experienced out-of-home placement. While we appreciate the intent behind Minnesota Senate File 3970, and the A2 amendment makes improvements, counties have concerns about implementation costs and an increase in case manager requirements. First, the bill expands eligibility for foster care benefits after age 18 to include youth whose permanent legal and physical custody was transferred to a relative. The second eligibility expansion permits young adults who are served by disability waivers to be eligible for extended foster care. When a youth enters or shifts to county adult disability services, their room and board is paid for by state housing support programs. This proposal allows youth to access extended foster care, for which the county levy pays for room and board costs. Additionally, waiver programs are specifically designed to provide long-term support and in many cases offer services that are more specialized than those provided through county child welfare foster care. Expanding foster care eligibility in this context could create overlapping program expectations or complicate service coordination. Both provisions would require additional staff to manage this eligibility expansion or increase caseload size for counties that are already beyond capacity, all during the critical period of implementation of MAPA CWDA. Finally, policy changes often arrive without corresponding updates to a fully modernized SSIS system, for which we will be thankful becomes a reality in a few years. When the technology lags behind the policy, counties are forced to absorb additional burdens and manual administrative work. We know children, youth, and families experience better outcomes when our staff can spend time with them rather than on paperwork. But when new policies increase administrative burden without supports, it pulls workers away from the very work that improves outcomes. Counties support the legislators' continued efforts to improve transition supports for young people leaving foster care. We respectfully encourage further discussion of approaches that strengthen those supports while maintaining clear permanency outcomes, avoiding unintended overlap across service systems, and additional burdens to county and court systems without additional support. Thank you for this opportunity to offer testimony today.
Thank you very much. Members, do you have any questions or comments on the bill? I don't see any other questions. It sounds like there's definitely a need for change. You know, people are not having an experience through the current systems that is allowing them to get through and develop their own healthy life. So it sounds like there is definitely a need. Senator Port, do you have any final comments?
Thank you, Madam Chair. I would just say not all kids who are placed with a family member or extended family have that full wraparound experience that we hope for. And those kids need support as they move out of foster care. And this just allows them to get the same supports that other foster care youth have. We are more than happy to continue working with the counties. And that's why we really shrunk this bill down this year to make it manageable.
Thank you. And Senate File 3970 will be laid over. There are no other comments. Senate File 3970 as amended is laid over. And Senator Port, you have one other bill that is going to a New York committee, and it has to do with your committee's jurisdiction, I believe. And do you want to try and do that quickly, and we can see if we can pass that out?
That would be great.
This is Senate File, excuse me, it's 1509.
It is 1509, and I have the A2, which just deletes, we're just using 1509 as the vehicle bill. This deletes everything in that bill and just puts the one section from my agency policy bill in it.
Senator Port moves the A2 amendment. Members, all those in favor, please signify by saying aye. Aye. Any opposed? The A2 amendment is adopted. Senator Port.
Thank you, Madam Chair. As we're continuing to make policy in the housing realm, we really value lived experience, folks who have experienced homelessness, experienced, supportive housing. All of these pieces are made better when we have folks who have lived experience. Unfortunately, what we're seeing is as those folks are receiving either some like small wages or a stipend, it's being counted as income against their access to MA or SNAP, their entitlement benefits. We don't want their involvement in the legislative process, in helping us make laws better, to kick them off of benefits that they deserve. So, Madam Chair, this just says that wages from lived experience involved in the legislative process do not count against you as you apply for state benefits.
And members, do you have any questions? I guess this is, just to be clear, and I think you stated it, it's part of the agency's, Housing Finance Agency?
That's correct. It's
Their
part of the Housing
policy-
Finance Agency's policy bill. They are including more lived experience as just part of their normal agency process, and they want to make sure that those folks who are providing that lived experience don't get harmed in their access to state benefits.
Okay. And so this part has relevance to our jurisdiction, but it will be heard in its entirety, the same language in your committee.
Correct.
We don't have to actually pass it out of here, but Senator Udke, do you have questions?
Yeah, thank you, Madam Chair. My question is, I'm looking at this quick, but trying to figure out what is the definition of lived experience? A little more detail in what that would be as far as the income.
Senator Port.
Thank you, Madam Chair. If you look at 114 to 117, it describes what lived experience and how the agency will work with it. We really want folks who have experienced the policy that we are working on, particularly homelessness, supportive housing. Those are the two main ones. And we want those folks to be able to give input into the policies that the agency is putting into place.
Senator Udke?
Thank you, Madam Chair. I heard that, but I guess I'm still not fully grasping, but I appreciate it. Thank you.
Any other questions or comments? Seeing none, Senator Port, any final thoughts? Or I think we'll lay it over and then you'll have that hearing completed. So
We'll hear it in my committee as well this afternoon, the full bill, but appreciate the committee's willingness to hear this.
Thank you. Seeing no other comments, Senate File 1509 as amended is laid over. And members, now we will break until 5:30, and we will reconvene in the Capitol in room G123. Is it, or no, just Capitol 123, sorry. It's on the first floor. So members, we are in recess.